my name is Julia. Welcome to my TED Talk on adolescent substance abuse recovery. So to start out this presentation, I'd like to ask all of you guys to close your eyes and in your head picture a drug addict. Go ahead and open your eyes. Are these some of the images that you saw in your head, right? If you did, you're not alone. Most people associate these kinds of images with addiction. And even if you didn't necessarily picture these images, I'm guessing that you probably didn't picture anything like this, right? Normal teenagers, we often associate addiction as an adult issue, when in reality what the data shows us is that 9 out of 10 adults with substance use disorder will begin using before the age of 18. So what if we reframe substance use disorder as an adolescent issue? Perhaps we can lessen the amount of adults that will struggle in the future. Now, unfortunately, only 7% of struggling adolescents will receive treatment, and this is really unfortunate. And the reason why I care so much about this is because when I was 13, I became part of the over 2 million adolescents in America that will struggle with substance use disorder. And I was also lucky enough to be a part of the 7% to receive treatment. And so because of this, I decided to dedicate my research this year to asking the question, what are the key factors for adolescent substance use disorder recovery, and how can those factors be implemented into an ideal treatment model? Now, as eager as I am to share my answer with you, first I have to go over some background information, such as what a substance use disorder is, how they develop in adolescence, and then how success is measured, and how abstinence fits into recovery, because it's probably not what you think it is. So a substance use disorder is a brain disorder that causes a person's inability to limit or control the use of mind-altering substances, causing an inability to function in society. Now, it's important to note that it's not necessarily dependent on the quantity of use or the type of substance use, but rather the inability to stop even when major unmanageability occurs. So then why? Why do substance use disorders develop in adolescence? Well, there's a multitude of reasons, some being boredom, peer pressure, unhealthy family dynamics, trauma, and untreated psychiatric disorders. And all of these kind of risk factors are exacerbated by the presence of an underdeveloped prefrontal cortex, and that's the part of the brain that deals with things like reasoning, judgment, impulsivity. So when you give adolescents these mind-altering substances, when their brain is physically not mature enough to handle it, it can quickly spiral into something unmanageable. And now before we get into the success factors, we now have to define success. What does that look like? Now, the broad assumption is that abstinence is the telltale and the end-all and be-all of success in recovery. But before we make that a fact, let's first look at the definition of recovery. Now, the Substance Abuse and Mental Health Services Administration defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. I don't know about you, but I don't see the word abstinence anywhere in that definition. So perhaps it's more effective to measure success based off of a different set of criteria, such as inability to meet self-made goals, a continuation in education, maintenance of healthy relationships with family and peers, as well as a progressive shift in mindset or reduction in symptoms. With that being said, however, abstinence definitely does play a role in recovery, but instead of it being a sole measurement, it should be seen as a tool in affecting success. Like, you can't aim to treat a substance use disorder without first taking substances out of the equation. Now, with this knowledge, we can explore the key factors, and my research has identified 4. The first one being understanding recovery as a process, not a destination. In other words, recovery isn't something to check off a to-do list, but rather it's a continual journey of growth and requires maintenance over a long period of time. There's 3 things that kind of go into this key factor. The first one is meeting kids where they're at and validating the space that they're in. Oftentimes, adolescents are not going to be willing or necessarily super motivated at the beginning, and so rather than shaming them for having that mindset, 2 therapists that I spoke to, Matt Silos and Donata Senda, who both work at residential treatment centers, emphasize the importance of letting kids know that it's okay that they're in that space, that it's okay that they might not want to stop using. It allows them to feel safe with the adults that are working with them and allows them to kind of ease into that process better. The second part of this is setting clear expectations and focusing on just one step at a time. Another part of the prefrontal cortex is future thinking, and kids have a lot harder of a time kind of looking super far ahead into the future, and that's kind of where they start making these impulsive decisions. So rather than framing recovery as like, you're never going to use again, or like looking super far into the future as to why we're doing this, kind of looking at short-term goals and short-term things that we can focus our attention on helps kids stay engaged into the process and helps them just see progress a lot quicker. And then the third part of this key factor is leaving room for mistakes and emphasizing the individual's strength and resilience. In a study done by SAMHSA, it showed that in a model that emphasizes room for relapse and establishes an overall improvement in the adolescent's health and well-being, the adolescent will be more resilient and hopeful about their progression even in the case of relapse. So moving on to the second key factor, building self-efficacy is crucial for adolescent substance use disorder recovery. Now, self-efficacy is essentially the belief that I can do this, I will do this, I want to, I have what it takes to accomplish what I'm trying to do. And, you know, we all know how well forcing a teenager to do something works. It, for the most part, it just does not. And so the only way to sustain long-lasting recovery is to get the teen engaged and motivated for themselves. As I talked about earlier, part of success, or part of the success criteria, is meeting self-made goals, not meeting goals made by somebody else. And so self-efficacy is shown to not only increase motivation, but also is shown to increase the ability for using coping skills, which is necessary if we're trying to see a reduction in symptoms. And then it's also a strong predictor of long-term abstinence. So now there's a lot of different ways that self-efficacy can be implemented into a treatment model. One of these is through motivational interviewing. And motivational interviewing is a patient-led, non-confrontational therapeutic approach in which therapists will ask the patient a series of questions to help the patient to identify their own goals and their own beliefs about their behaviors. And so, for example, in an MI session, a therapist might ask the student to create a timeline of their using history and then ask that student to identify for themselves where they see their problems starting to come up. So the patient is identifying for that self, not identifying that for themselves, not being told. And MI is really important because, like I said, it gives the patient agency, because rather than being told, they're being asked, and they're able to feel the positive outcomes of taking accountability for their own lives. In a study done by psychiatrists in India, they found that there was a greater increase in self-efficacy after MI was administered compared to the group that just had treatment as usual administered to them, as you can see in the graphs. And this is for patients with alcohol dependency. So this just goes to show that motivational interviewing does increase self-efficacy. So now moving on to the key factor number 3, which is dual treatment for co-occurring psychiatric disorders. Now, dual treatment essentially is not only treating the substance use disorder, but also any other disorders that may be present in the adolescent. Commonly associated with substance use disorder are things like anxiety, depression, PTSD, and ADHD. It was shown through a lot of different studies that over 60% of adolescents will be dual diagnosed, and this makes sense because untreated psychiatric disorders, as we established earlier, are a cause of substance use disorder development. And so this is important because these disorders can often exacerbate the substance abuse and simultaneously, the substance abuse can mask the disorder symptoms. And so to give you an example, let's say you have a kid who's struggling a lot with anxiety, and so they start using weed to cope with that anxiety. However, the weed is not treating the anxiety, it's just masking the symptoms of that anxiety. And so on the one hand, you have a kid who's not treating the anxiety, so the anxiety is getting worse because it's just getting masked. And on the other hand, now the kid has to keep smoking weed in order to deal with the anxiety, and they have to keep smoking more and more because their tolerance is going to build up to that drug. And so nothing gets fixed, nothing works, and if we don't use dual treatment, then the substance use disorder can progress further down the road. One implementation of dual treatment is a type of therapy called cognitive behavioral therapy. And this therapy is a type of talk therapy that is built off of the premise that thoughts can cause behaviors. And so what CBT aims to do is to modify those harmful behaviors by addressing core thought patterns and developing coping skills. There was multiple studies that I found, including a study called Project Match, which found that CBT was the most effective form of therapy for treating substance use disorder when interacting with these other kinds of disorders. In my personal experience, when I first got into recovery, I thought that I was just using because I wanted to and because it was super fun and whatever. And then when I started doing CBT with a therapist, as well as working with a psychiatrist, I started to understand that the real reason why I was using was because I had untreated PTSD, I had unmedicated ADHD, and untreated depression. And what I was really doing was using drugs as a way to numb myself from the feelings that those other disorders were causing me. And so, like I said, once you take substances out of the equation, those untreated disorders will often come up stronger because we're not medicating them anymore. And so we're going to need coping skills to deal with that, which leads to the fourth key factor, which is community. And there's kind of two sides to this, right? There's the family aspect and then there's the peer aspect. So to start out with the family side of things, family involvement is crucial for recovery because not only does the family system lie at the heart of the social and emotional development of an adolescent, but it is also, or substance use disorder can also be predicted by a series of familial risk factors, such as poor communication in the household, or if there's a parent or person in the household that is also using addictively. And so family involvement through methods like family therapy aims to address and mitigate those risk factors. Family therapy can be really helpful in kind of getting everyone in the household on the same page, developing kind of a new sort of vocabulary to use around problem behaviors and around using. And in a 2009 focus group, they found that with adolescents that their families were involved in treatment, the kid was less likely to hide their using from their family if they did relapse, and they were also more likely to engage in their treatment work. A different type of implementation of family involvement is through the use of home contracts. And what home contracts are is kind of the adolescent and the family will sit down with the therapist or social worker and develop schedules, develop kind of relapse prevention plans. A lot of the time it looks like getting involved in activities after school, developing safe words and different communication styles. So when problems do come up, if a family member is triggered by something that the adolescent is doing, instead of immediately jumping to this like super intense reaction, they have kind of a better understanding of each other and they have this vocabulary that they can use to diffuse the situation and move forward. Now the other side of community, probably one of my favorite things to talk about in terms of recovery is community, peer-based community. And what peer-based community provides is a healthy alternative to those groups that the adolescent was using with prior to getting into recovery. As established earlier, peer pressure is a cause of substance use disorder, and so it's crucial for the adolescent to find a replacement for those groups that they were using with, and to develop a healthy sense of self, a healthy self-esteem, so that they're less likely to go back to those groups that they were using with before. And also at the same time, let's say if a kid gets involved with a group of people that are all highly motivated and engaged in their recovery, peer pressure can work in a positive way. The kid's probably going to be more motivated and likely to engage in their treatment if all their friends are also doing the same thing. And also these peer-based recovery groups allow adolescents to find support outside of a clinical setting. Instead of just sitting across from a therapist in a room with like a one window and just talking about all these serious things, you know, kids are getting out and they're going and doing things outside. They're having fun, they're laughing at the same time they're recovering. So this is just more of a lighthearted, fun way for kids to see that you can have fun without drugs and alcohol. And now there's a lot of different types of peer-based recovery communities out there. For example, 12-step groups like Narcotics Anonymous and Alcoholics Anonymous. There's also these new things popping up everywhere called recovery high schools. And essentially what recovery high schools are they're normal high schools, normal classes, but they're designed specifically for kids in recovery. So every kid there has a desire to stop using and is working in an outside recovery program. And not only are they able to get an education and go to classes, but each morning and afternoon they have all school recovery meetings. And there's other types of guardrails set in place. Kids can meet with recovery counselors and such like that to help them in their recovery. And actually in Denver, there's the biggest, most successful recovery high school, with, I think right now it's about 300 kids there. And so they have a huge group in Denver, right here in our state. And in a self-conducted survey, I found that 12 out of 17 adolescents found peer-based recovery groups to be the most beneficial part of their recovery. And I think this is because addiction is such a shame-inducing and isolating disease or disorder that peer-based recovery groups are perfect for making adolescents feel understood and accepted, not in spite of their addiction, but for their addiction. And so I just spewed a lot of things at you, so I'm hoping that I can leave you with a few key ideas. The first one is to pay attention. Addiction isn't one size fits all, and especially in adolescence, it may not look as in your face as those first images I just showed you. So it's important to pay attention to the small things and pay attention to the young people in your life. Make sure that they're doing okay, because addiction can be a really sneaky disorder that may not look like a homeless person sitting on the side of the road. The second is to have empathy. As I've just shown you and proven to you in the last 15 minutes, recovery is a lot more than just not using drugs. It takes a lot of time and effort and reflection. So for the people in your life who are trying to recover, having grace and having compassion really is a motivator. It was really helpful for me when the people in my life saw and validated how hard I was working. It made me want to keep doing it. It made me want to keep going. And then the third is to speak up, and I think this is probably the most important piece. Oftentimes, especially in youth culture, we have this negative connotation around reaching out to people or reaching out on behalf of somebody, and we label it as snitching. When it comes to substance use and substance abuse, which is a deadly disorder that kills people every single day, there's no such thing as snitching, because you were saving somebody's life potentially. And in fact, recovery only happened for me when a couple of my friends snitched on me, and in terms they saved my life. And because of them, and because of implementing these factors in my life, I can stand up here and express my confidence in substance use disorder recovery, because it has given me joy and freedom that I did not think was possible at 13 years old. And so if you are someone you know is struggling, I want you to know that there is hope and you are not alone. And so thank you so much for coming to my TED Talk.